Mistakes. None of us want to make them, but these are the three biggest mistakes that I see people making in labor. And I got to tell you, it has nothing to do with this bag boy. It doesn't have anything to do with your pelvis or your baby or anything like that, frankly, because we don't control a whole ton of that. But these ones are ones you can change. But of course, when you're talking about the labor room and you're talking about mistakes, you want to make sure that you're learning from an expert. Hello, I'm Hilary. I'm the pregnancy nurse, and I've basically been living in labor rooms since 2001. So I really understand what you're up against in labor. I've seen thousands of births and lots of mistakes. So let's get to it. The biggest mistake I see people making right now is that they are getting prepared for birth on social media. Now, there are a lot of people, including me, on social media that can be super, super helpful. So today I'm going to give you 3 questions that you can ask if this is somebody that you can trust and somebody that you want to be listening to. Because there is a lot of bad information out there, and I don't want that for you. Number 1, do they do most of their deliveries like you plan to deliver? There are people on these apps who talk about a lot about birth, but mostly have done home deliveries. Now, if you're having a home delivery, listen to them. Don't listen to me because I honestly don't know that much about home births. But if you're planning to deliver in a hospital, you may want to rethink listening to those people because their advice is for a home birth, which is very different than a hospital birth. Number 2, what are their qualifications? You're wanting to look for initials behind the name. For me, I'm Hilary Erickson, RN, BSN, which means I went to school, I have a bachelor's degree, and I've worked in nursing. Along with that, as I just told you, I worked in labor and delivery for 20 years, starting in 2001, and now I'm a prenatal educator that educates people worldwide about how to prepare for their upcoming hospital birth. But when you're listening to somebody who's a doula, you have to realize that they don't have all that training behind them. Beyond what I learned in my bachelor's degree, there's a whole lot more that I learned as a labor and delivery nurse. I am advanced fetal monitoring trained. I know how to do ACLS. I know how to do NRP, which is saving your baby if they come out and don't look so great. So I have all these qualifications that really help me understand how to help people over a wide variety of population coming in for their hospital birth. So ultimately, I think you really want to look for a nurse or perhaps a doctor, midwife. Honestly, even nurse practitioners and physician's assistants, they cannot deliver in the hospital. And so it's difficult to really take their advice about a hospital delivery. They can definitely educate you on your pregnancy wellness though. And finally, do they have experience? I could be Hilary Erickson, RN, BSN, and have never worked in labor and delivery, which doesn't make me any more qualified than just a doula to talk to you about delivering in the hospital. How much experience do they have? Now, there are a lot of doulas out there who are wildly experienced, and I take their advice too, but you have to realize how much experience do they have over a wide variety of populations, usually delivering in the way that you're hoping to deliver. Experience matters. In fact, I see a lot of first-year residents on TikTok talking about what they learned in labor and delivery on that first day, and I'm like, because they don't have a lot of experience. They don't have like a lot of things to take it from, and sometimes their information is good, and sometimes it's not so good because they're just learning. By the way, love me some residents. So make sure that you're qualifying who you're paying attention to as you are learning about your upcoming birth. As a side note, birth stories can be really difficult. Just because Sally down the street experienced one thing at her birth or tells us that she experienced one thing during her birth doesn't mean that you're going to experience that at your birth. So that's something important to know as well. Now, how does this apply to real life? On the internet, I've seen a lot of people saying you can deny cervical exams at any time. And this is really difficult to swallow because cervical exams are an important tool in our toolbox to help you when you come into labor and delivery. And making blanket statements like you can deny a cervical exam at any time is not helping you make choices at the time that it happens. Am I on the train that we do too many cervical exams? Yes. Am I on the train that cervical exams often don't tell us anything, especially when you're like 36 weeks pregnant? Yes. However, when you come into labor and delivery, they are an important diagnostic tool that we learn a lot about you and how your labor is progressing when we use them correctly. So what they're saying has a bit of truth. Yes, we do them too frequently. Yes, there are times you can refuse them, but blanket statements do not help you understand how to use that as you go into your upcoming birth. As a side note, some people absolutely love their cervical exams. It helps them feel more in control. And some people absolutely hate their cervical exams. And we have to find a happy medium for ourselves when we go in to have our babies at the hospital. Honestly, I see it's talked about so much online, but it's really not a problem at the hospital because when people come in, they really realize that it's an important diagnostic tool. Okay, the second biggest mistake that I see people making, and this one specifically in the hospital, is staying quiet when you want to learn more. Now, your provider is going to come into it could be your hospital room, it could be the examination room in their office, and they're going to say, you know, Sally, I recommend a C-section. I think the baby isn't progressing, blah, 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 right? And at that point, you can make the choice to say, sure, let's do that. And then later on, I'm going to see that you felt forced to have that go on. Or at that point, you could start to ask questions. Okay, what are we seeing? Is the baby unsafe? Whatever's going on at the time. That is your opportunity to ask questions. Now, a little bit less intimidating than a C-section is they might come into your examination room and say, Sally, I think we need to have an induction. Baby isn't growing as well in the womb, or you have too much amniotic fluid or too little amniotic fluid. They're going to tell you exactly what they're seeing. And at that point in time, you can just say, yes, that sounds fine to me. Or you can ask questions. I cannot tell you how many times I just had patients say, okay, and then I knew that they felt forced into having that C-section. But you can always ask questions. There are very few black and white things going on in labor and delivery. And in fact, if it is a black and white situation, you're likely going to see a lot of staff in your room with very urgent needs and telling you exactly why we need to do what we're doing. Most often, it's your provider coming in calmly saying, this is what I'm going to recommend for you. And then you get to make the choice. And the biggest mistake is just saying okay, because then you ultimately do not feel in control of the situation. Now, a great provider is going to ask you if you have questions. They're going to prompt you to do more and more, but sometimes they're busy, they're tired, or sometimes I see them say, what kind of questions do you have? And the patient goes, nothing. And then I can just see that they're upset and defeated and they don't really understand why all this is happening or that they could make another choice. That is honestly the number one mistake that I see in the labor and delivery room. So often I hear providers come in and recommend something, and then the patient just says yes, and then they feel defeated inside. And I think that's ultimately how birth trauma ends up happening. And it's a two-way street. Providers need to give a better informed consent, but also patients need to ask more questions so that they can make the choice for themselves. And if you haven't watched any of my other videos on this channel, I talk about making choices for yourself in the moment so much. So make sure you check out all my other videos. In fact, if you could give this video a like and subscribe, we'd really appreciate it. We're really trying to grow our channel over here at The Pregnancy Nurse, and every like and subscribe really helps us grow. Okay, the final big mistake that I see people doing is not getting prepared with their partner. The thing is, pregnancy is just happening to you. So you're likely doing some preparation. You might be reading some books. You might be watching social media, hopefully the right social media, but your partner is likely not doing that. And a lot of times people don't make birth classes a priority, sometimes because they're at Tuesdays at 6 p.m. at the hospital and finding parking and then sitting in the hard chair for 3 hours, plus making it fit your schedule is really difficult. The good news is now that we are in 2025, there are so many great options online that you can fit into your schedule. The problem is a lot of those birth classes are really just focused on mom. They don't talk a lot about how the partner can learn about their upcoming birth, learn about how to take care of their baby, learn about what to expect postpartum, because your partner has a lot of skin in the game, both at birth and then postpartum when you bring that baby home. They really need to learn about that stuff. Sure, you might be the only one that wants to learn about changes in discharge during pregnancy, but they're really going to want to know, how am I going to take care of this baby when it comes home? And one of the other things a lot of people don't think about is you guys might be entirely on the wrong pages. You might be thinking, I'm planning to have the baby sleep in a bassinet by the bed. And your partner might be thinking, we created a nursery. This baby is living in the nursery. So then you get home and partner thinks this baby's going to the nursery. And then he suddenly realizes baby's living in your room and they had no idea. Or sometimes their partner thinks my mom's coming to the delivery because her mom's coming to the delivery, and they might not have any idea that that's just not okay for you and your open legs at delivery. So it's really important to start those conversations now and get prepared together. The online prenatal class for couples is the easy way for both of you to get prepared for birth. It is online, available 24/7, it's affordable, and it's created to be done with your partner so that you have a teammate, not just a cheerleader. Now, an example of this is I cannot tell you how often I have seen the partner just sitting in the chair by the bed, scrolling TikTok, watching movies on their own, feeling anxious and nervous because they have no idea what's going on. This person that they love is suffering in the bed next to them. They have no idea how to help. They have no idea how to be a support for them. So instead, they watch TikToks in their chair. That's not what I want for you. I want a partner who's engaged in the process for you, and I hope you want that too. Now, this doesn't have to be a husband or boyfriend. It can be a friend, your mom, somebody that's important to you. Getting them engaged in the labor process can really help. And I think you'll agree, it's so nice to have a buddy in a class with you. Now, if you want to learn more about mistakes, I have some third trimester mistakes that people make that you guys can check out. Which of these mistakes are you afraid of making? Tell us down in the comments. I'm so glad that you're here. Let's get prepared, not scared.